You're listening to HealthcareNOW Radio. Stand by for This Just In, the latest in healthcare innovation and technology trends with your HIT advisor, Justin Barnes.
Thank you, everybody, and tuning back into us. And I certainly want to thank everybody from Business Radio X who's producing this live HIMSS19 segment of This Just In Radio Show. I'm your host, Justin Barnes, and also many thanks to our partners who support the show, Lenovo Health, Intel Health, this panel. Very excited about. We always do one panel every single year. This is the Think Beyond Health Innovation panel. So let me walk through and have everybody introduce themselves. We'll start with you, Farhad, on the end, and come on down.
I'm Farhad Chowdhury. I'm the CEO and founder of Vienova Health.
And we'll dive into Vienova in a moment, but very excited to hear more about your technology.
Hi, everyone. Andy Nieto, Global Healthcare Solutions Manager with Lenovo Health.
Hi, and Andy Bartley, Global Account Manager for Intel Health.
Excellent. Thank you, gentlemen. Truly appreciate it. So starting off, what we're going to do is we're going to talk about where innovation is today, where it's going, how people can successfully navigate it, what best practices can we offer. But then I also want to look into the crystal ball a little bit. I want to really give people a glide path in a way, but really tell them, hey, this is where we are. And Andy, you brought up some great stuff in our last think tank around AI being implemented in the care delivery plan and care strategy by physicians, and physicians want to be trained. Those kind of things are breakthroughs in some ways, because we keep hearing how AI is hyped a lot, and while it is a little bit, it's here and now. And every single person that sat for the last 2 hours on this show brought up AI in some capacity. And you have an AI platform here and live today. So, yeah, very, very cool. So I'm looking very forward to this segment. So we will talk about where healthcare is today, but then also let's give them some projections of where it's going so people can kind of look up as well. So before we dive in too deep, Farhad, probably the company that we don't know most about. So tell us give us a couple minutes on Vienova Health and what you guys do accomplish and your technology.
Yeah, so Vienova Health, we've created a remote patient monitoring platform, but built inside of it is Rosie. It's a virtual nurse.
I love the name, Rosie.
Rosie, yeah.
That's awesome.
It's a virtual nurse.
Yeah.
And inside of the platform, what's amazing about it is she's helping with behavior modification and creating tiny, healthy habits. And so every single day, our patients check in with Rosie in the morning. Cool. It's connected to a clinical command center, a bunch of biometric devices pulling vitals, but it also sends alerts and messages to family members and to physicians. But there's a social reinforcement element to this, and we're using the best habit formation science coming out of Stanford Behavior Design Lab with Dr. BJ Fogg. And so we're really trying to be psychology, technology, creating tiny, healthy habits.
I love it. Fantastic. Andy, tell us a bit about your role and what you guys are thinking about. And we'll dive into some of the deeper thought leadership stuff. But what are you focused on from Lenovo?
So at Lenovo Health right now, we're focusing on bringing solutions that actually solve real-world problems in healthcare. We're really focusing on how we bring solutions, whether it's a technology solution around an end-to-end VDI strategy or...
VDI is virtual desktop?
Virtual desktop infrastructure, absolutely. Also looking at solutions around how we bring to market partners like Vienova and bring solutions to home health, bring solutions to what's going on with augmented reality and virtual reality, and how we bring those directly to the hands of the patient and the providers, and how we're enabling different solutions. So Lenovo Health is really about bringing all the players together and best-of-breed solutions.
Love it. So talking about bringing players together with best-of-breed solutions, Intel. Andy, I love you guys. You guys have been great supporters of mine and my radio show since inception, and actually going back 15 years. So thank you for that. But what are you mainly focused on right now for Intel?
Yeah, it's an exciting time in healthcare, right? There's lots of big shifts happening, which makes it even more important than ever to focus in on a couple of critical areas. So the 4 areas that we're focused on from Intel Health are AI, and it's really about extracting the maximum amount of value from the digital data that you've captured across the organization. We'll talk more about that later. Precision medicine. Today, a focus on bringing genomics into the clinical workflow. I think a lot of work on primary and secondary analysis, so looking more at tertiary analysis now, that interpretation. Distributed care delivered outside of the inpatient setting for chronic disease populations, aging populations, and then continuing to focus on digital infrastructure. The wave of EMRs has rolled through healthcare, but there's still a lot of opportunity to optimize and modernize that existing infrastructure to allow for things like AI and precision medicine to really scale at the population level.
Excellent. So let's carry on there. So tell me, you just went through 4 main focal points, but what are the main healthcare, health IT trends that you personally are navigating or that you look forward to navigating here over the next year or so? What trends are you watching?
Yeah, so the health IT trends, I think you'd be remiss to not mention the use of data. I'll put it that way. So we'll maybe rebrand it from AI to use of data.
I like it.
Yeah, and it's that trend you talked about. It's here now. So it's here now in a big way, but it's in a lot of these sort of not sexy use cases, the back office use cases, operations. How do I improve my staffing? How do I improve workflows through the hospital? How do I improve my revenue cycle management? And these are critical applications of AI that free up dollars and resources within the healthcare organization to go and invest in new and innovative areas like direct patient care. So we see AI actually unlocking IT budgets and resources to drive innovation, right? The more you can pull cost out of those legacy areas of the business, the more you can invest. I think the other is organizations that are understanding where and how to place their computational workloads. So there's a whole industry now around the cloud, not a new thing, but I think for healthcare, understanding how to leverage the cloud alongside the infrastructure that they have to be more nimble, be more agile, provide new and innovative services to their patients, to their patient populations that can scale outside of their 4 walls, going back to distributed care, and really enabling it with more scalable infrastructure that can tie back in real time. So those are 2 that I think are pretty exciting.
Oh, very cool. What are you seeing, Andy, for healthcare trends and IT trends?
One of the trends I'm seeing is a return to baseline expectations to security, privacy, access control, interoperability, and finding ways to really improve, to evolve as threats evolve, also finding ways to evolve the technology and the resources available to IT budgets without driving the costs through the roof. The other thing that I'm seeing is just an expectation that additional technologies are accessible and more tolerance and more interest in, let's try that with a finite population. Let's evaluate that with just a few people at a time and see how it's going to work, and more interest in doing that. So those are 2 that I think are really exciting right now.
And actually, the latter point is something that's even come out in the last couple of think tanks where we said, hey, you've got to start, say, virtual care, and you just take a segment of your population or a certain disease state. You don't have to go all in. We don't actually recommend doing the entire healthcare system all at one time, but take a segment of population, 100, 200, 1,000, 2,000 people, and start there and then build out. Excellent. So Farhad, tell me about what you guys are focusing on for trends with ViaNova.
Yeah, for us in particular, we're trying to address the fundamental problem of care plan adherence. At the end of the day, doctors are prescribing the thing, but the overwhelming majority of patients within 30 days, about 80%, stop following it. So how do you ensure that? And so we've created a platform that's focused on the problem that many physicians aren't looking at, which is the habit formation around actually them following what doctors have prescribed. So our trends is looking at different devices, whether they're wearables. We have a pill box for medication adherence, smart pill box, and with the home hub. But on top of all of that, we're looking at, it's all about behavior change. It's all about behavior modification for us. And honestly, that's why we've been expanding with a lot of different clientele. They're looking for a deeper way of doing visualization of habit formation. And I think we are one of the first companies to break through with that. And we're looking for working with Lenovo and Intel to expand that further.
Yep. So diving into now one level deeper there, what are 2 or 3 best practices that you can offer out? It might be with your solution, but even if not, engage in these type of technologies. How to, what best practices can you offer to, say, consumers or care providers or health systems to engage?
I think when it comes to best practices, it's about one of the things that we immediately do is we go in and we do a certain amount of training to the clinician, as well as it's a combination of working with the provider and working with the patient for both of them to think in terms of habit formation and thinking about them checking in every single day, doing something every day, and lights turning on and off. So we have this entire training approach, but we also have the technology doing that, and then social reinforcement and family engagement. And if you look at the data and the studies and the analysis, it's how you engage the family, how Rosie suggests to the family member what type of messaging and engagement they should have with their family loved ones that leads to the greatest response and reaction. So connected care and making it complete.
So give me an example of that. How would Rosie, I think of my 94-year-old grandmother who I help with her care. I live in Atlanta, she lives in Boston, and I try to help her as much as possible. But, it would be, hey, Graham did not take her pills today, and then you alert me, and was that stuff you're talking about, or even at a much better level.
Yeah, with most of our clientele, it's a combination of Rosie alerts their clinical coordination team, their nurses, whoever have. We built an entire platform. They leverage that clinical command center, but it also then pings the family member.
Right.
And what Rosie is doing in terms of AI, and I don't want to use it in a gimmicky way.
Yeah.
AI is about personalization. How do I take all that data and say, oh, when the daughter responds, they react better. Like my dad.
Right.
I could respond to my dad, but when my wife does it, because that's his daughter-in-law, he seems to respond a lot better. So now the messages go to her. It's things like that, high personalization and and adapting along the way.
I love it. That's some of the great ideas right there. I like that. Andy, so tell me about some best practices that you guys are offering or you're thinking about and you're educating people on how to navigate some of these trends out there.
So one of the things that we're looking at right now is in security, having a within your technology partner, within your whatever vendor of choice that you're working with, understanding what their technology framework is for security, what is their practice for security. At Lenovo, with our ThinkShield portfolio, as we look at device security, data security, online private security, and authentication and access control as an entire environment of security and privacy. Having a plan and a partner that you can really align with and dive into with, and how does that play into all of the rest of your portfolio? Security is a multifold problem, right? We have to deal with threats, but we also have to deal with management internally.
Yeah.
Who has access to what? How do they access it? And it's multi-layered. We don't have just one vendor. If we had just one vendor, HIMSS would be about 10 booths, right? I think there's 1,700 booths here today.
Right.
And so we have to work with all of these different partners to have an environment where we address security and privacy. Whether we're talking about how they log into their desktop or how they log into the EHR or how we track a patient at home, and how do we know that 7-year-old Timmy isn't playing with Rosie instead of Grandma who's assigned Rosie.
Yep.
So all of these different elements play into that. And so the best practice I recommend is really having a partner that you trust, that you can interact with, who understands these problems and is willing to go to bat with you.
It's awesome. And I smile every time you say the word Rosie, the name Rosie. I smile because I actually had a robot that one company that I invested in still to this day is in hospital space, but they have a robot. And they said, what do we want to name the robot? And I said, Rosie. You got to name the robot Rosie. They actually went with Magellan, but I wanted Rosie.
Should have stayed more personable with Rosie.
Exactly. Thank you. So from your perspective, from Intel's perspective, what are 2 or 3 best practices that you can tell my audience, how to successfully navigate healthcare or certain of the trends that you spoke about earlier?
Yeah, so I wanted to go back to one. This wasn't one I was going to mention, but Farhad, I think, mentioned the change management piece. And
so important.
It's so critical as a technology provider that you take ownership for getting that technology integrated into the workflow. We get trained on procedures, but we live our habits.
That's right.
And so it's not enough to think about getting that procedure rewritten. It's how do I go in and fundamentally change a habit that someone's in. When you read the habit science, it's daunting. Changing habits is really, really hard.
Who Moved My Cheese, that book from 20 years ago.
Who Moved My Cheese, man. Yeah, it's a short read, and there's great science out about it. But it's a sustained effort over a long period of time, and you have to come in with the right mindset and the ability to resource and focus and provide the right kind of encouragement throughout to change that habit if you want to drive engagement. So I love that point. I love the word habit being used, not just workflow being used, but habit. I think another is, and Andy and the team here really demonstrate this, is it's about creating an ecosystem and partnerships. I think the industry has and will continue to ask for solutions.
Yes.
It's not about piece parts. I need full solutions, and there's no one company that can provide it all. It's about forming the right partnerships that are complementary, that are deeply rooted in the customer value proposition that they're asking for. So it requires knowing your customer sometimes better than they know themselves.
Right.
And then being able to work across the ecosystem
AI can help with
collaboratively.
that.
Yeah.
Sorry.
I know that to be true. That's right. Yeah.
Exactly.
Yeah, but you see it in the booth here with the partnerships that have been formed, leveraging those core Lenovo assets, but then bringing in the innovators that can complement that and really take it to market as an end-to-end solution. So I think those are both really critical pieces to making it work, right? Making the innovation stick.
No, I think it's fantastic, and even Rasu, Dr. Shresha, who was on earlier, has been as his national global speaking circuit on unlearning things, and I think it goes back to change management. What habits do we have, and what can we unlearn? We can't just keep piling on, because how we did something 10 years ago is not how we're going to do it today. But yet we still go through the same motions, we have the same habits, and so very important to all this great innovation is in how do we approach moving forward with this great innovation, and not the exact same way we approach everything else before. So it's unlearning, and what have you unlearned today? And if we actually think about every single day, because that means you're being very self-aware, you're thinking ahead, and then also what I need to unlearn today or this week. So it really feeds into exactly what we're talking about.
I think that goes even further when we start talking about IT departments and IT industry. Unlearning the concept of we've always done it that way.
Correct.
And
that could really hold you back.
Absolutely, and looking at a partner and saying, well, we have a firewall. We've always relied on that. We've had this. We've always relied on it. And to start looking at it as a dynamic and living, breathing environment.
Yep. So before we move into our next segment, I see these black shirts out there. You're wearing one, Andy. It says, what is it? What does your black shirt say?
It says, "Sequence me." Sequence me.
I actually thought it when you first walked up. I thought it said, "Squeeze me." I'm like, why is he wearing that shirt?
You can go there too. I'm good.
That's great. You're a good man. No, so sequence me. There's another one over there. Give me 30 seconds on that.
Yeah, it's for the Intel Health team. One of our colleagues, Bryce Olson, well known in the precision medicine industry, cancer survivor.
Yes.
And Bryce had his whole genome sequenced, and in order to find the right clinical trial, he had to take his own genome, work with providers, and go find a clinical trial to insert himself into. So the standard of care, the standard clinical workflow around using that genomics failed him, but he had the persistence and the understanding of the industry to know how to get himself in, and that's extended and saved his life, literally. And so we've got the shirts on to raise awareness for the importance of thinking about how we bring genomics in and make precision medicine real.
I love it. I'm actually going to learn more. One of the areas that I have not been up on is social determinants of health, and so my next couple of speakers coming up later this afternoon is about that, and there's a lot of precision medicine in that, and then certainly in sequencing. So fantastic. So now, go to you, Farhad. Thinking ahead, HIMSS is a lot about here and now. Which is great, because we need to know what's happening today, we need to know what's happening immediately tomorrow, but thinking 3 years from now, and thinking out there, what would you tell my audience, what do you have to keep an eye on or think about or be cognizant of to be successful and to thrive in the future? So 3 years from now, what should we be looking for?
I think that you're just seeing a further expansion of it going from the hospital into the home on multiple levels, and you're seeing this kind of explosion of wearables. But how do all those wearables connect? What does that mean? How does it react? How does it get smarter? And how does it personalize? It's that deep personalization that I think that's missing. And so people, like I said, use the word AI, but it's about that deep personalization. And then going back to looking at saying, how do I get into the emotional state of people and their mental health? You're seeing mental health is chronic care management, but a big boom into that space as well. So again, AI applied to that space. That's where we're looking.
That's fantastic. I love it. It's great. Andy?
So I think we're going to see in the next 3 years.
And I realize we have two Andys, so Andy Nieto.
Yeah.
Not Andy Bartley. Andy Nieto.
I really think that one of the things we're going to really see in the next 3 years is a shift from patient-centered medicine to person-centered medicine. I think we're going to stop thinking about healthcare from a facility to facility, provider to provider, and start thinking about it in a more holistic, person-centered. I'm dealing with the person, whether they're at home, whether they're at work, whether they're at school, whether they're in the doctor's office, whether they're in the hospital. We're going to be looking at the person as a whole unit, and not as okay, I'm seeing Dr. So-and-so today, I'm in the hospital today, I'm in the ER today. And I think as that environment becomes a little bit more consumer-driven, we're going to see more personalization in the way it's delivered, and I think we're going to take that to the point that not only will I have a longitudinal personal record, a health record, which everyone has shared, because we're going to solve interoperability, but it's going to matter whether I'm dealing with it in the home, and we're going to be leveraging incredible technology to have sequenced medicine. We're going to actually know who we are, and it's going to be a one-to-one delivery of medicine.
It's fantastic. Love it. Andy Bartley?
Yeah, so too, I'd go back to care into the home, really the social determinants of health. For the 99% of the time that we don't spend in the hospital, but drive a lot of the causing factors that force us to go into the hospital. What's happening in our community? What's happening in our home life, in our friendship circles, in our work life? that is influencing that. And that's an area where you've got a bit of digitization, very, very fragmented. And so I think the next theme that I'd look at as we start to understand that and tie it all together is advances in underlying data architectures to store very large disparate data sets. Because we're going to realize with AI today, we're applying AI to one or two data sets at a time, or we're solving very point problems because there's lots of low-hanging fruit out there. As we get more sophisticated in the use of data and we try to expand our knowledge of the patient out into the community, there's going to be entirely new architectures and approaches to storing these data sets and analyzing these data sets. And AI will be a piece of it, but there'll be new types of AI that emerge, memory systems that have to emerge alongside the traditional machine learning techniques that are used today to make all of it come together.
Excellent. Let's take a step. There's two questions I want to follow up with, but for one of them, I really found fascinating. I touched on the opening of this segment around, and you mentioned this in our last Think Tank 4, around physicians wanting to be trained on AI. Can you spend a minute on that? Because that's pretty fascinating. You kind of when you said that, I took a step back in my seat and I'm like, oh my gosh, because I would not have guessed that. You could not have paid me to think that. They kind of want to do their own thing and they know a lot about their own stuff. But then if they're actually ready for it and relevant to AI, talk about that for a moment, please.
Yeah, I think the positioning that's being used instead of artificial intelligence is augmented intelligence.
Right,
and I think when you go talk to providers, the amount of time they have to spend doing clerical kind of work in the EMR, we talk a lot about staff burnout and physician burnout and frustration with using the systems. Applying AI to make that easier, to take away those mundane tasks so they're able to operate at the top of their license, you're seeing physicians understand how it can be applied there. And I think you're seeing a realization from the technology providers, which a lot of entrepreneurs come into a market, and a lot of times the mentality is, this market's broken, I'm going to fix it, which infers that what you're doing is wrong, and I'm going to come in and do it better. Mm-hmm. They're coming in with more of a partnership mentality of, I have complementary technology, there are things that you're doing that aren't optimal, and I can help optimize that. I can help make you work less hours but be more productive, spend more time with your patients, and get home and spend more time with your family, because providers are people too.
Right. Yeah.
And as much as they care about the patient, they got families they want to get home and spend time with. So I think that repositioning, as the AI vendors have understood how this fits with the workflow, and it's more of a us and not an us versus kind of mentality, that's really helped there.
That's awesome.
It's one of the things that's really interesting that I see in that is that shift is also our providers were very much about dealing with the EHR. We had that whole EHR wave where they were resistant to technology. There was a real resistance to that adoption. We've gotten over that hurdle now. Now that they've adopted, they're saying, okay, give me more. I'm ready for more. I'm more accepting of more. I'm open to learning more and using it more.
It's excellent. Anything you want to add to that, Farhad?
I mean, we've just seen a lot more of, we want to be able to, we use AI to amplify instead of AI to replace. And and the amplification of that is really just moving into that personalization. That's basically that's the point.
Excellent. From a global perspective, because last year we talked about global health, what would you, and ask this in any of you, but what is your perspective on how Intel is tackling global health, or from a global strategy?
So I think the four trends that I laid out, AI, distributed care, precision medicine, and digital infrastructure, play out at a global scale. What's interesting, though, is you'll see different markets moving at different speeds along those. So if you look at China, for example, precision medicine's moving very quickly, and AI is moving very quickly, and they're constrained by the number of providers they have to support such a large population. So there's natural factors just trying to provide care to that many individuals that forces them to be more innovative. And I think in some, outside the U.S., more centralized healthcare systems, it's a little easier to get things done. Yeah. There's fewer decision makers, not necessarily less politics, but a little bit more centralized. And so you see countries able to implement. We were just talking this morning. There's up to about 50 countrywide genomics programs now being spun up around the world. Different countrywide initiatives that are driving the adoption of genomics because it's easier to do it in those countries, and traditional drug development does not take into account the unique attributes of specific populations. It's primarily a European white male sample set that's used to develop these drugs. And so as we think about precision medicine, we have to think about some of the fundamental processes we use to develop medicine today. Yeah. And where do those start to break down, and where do we need to innovate? So some really interesting. I think that this precision medicine, personalized medicine trend is playing out in different ways, but that's really, I think, at a global level, one that we see getting a lot of steam and really have a big impact.
Yeah, you actually made me think about, I had a guest on my radio show about a year ago, and she mentioned cultural intelligence because of a lot of, drugs are built for white males a lot of the times, but why don't they test in other populations as well? Or they may not be because we don't have the sequencing, we don't have the DNA. These drugs are not maybe as good for them as they are for us. And she's brought up, it's called cultural intelligence, and all of my bells went off. I'm like, oh my gosh, that makes a lot of sense because a lot of stuff I didn't know about. But it makes complete sense, and that's what she's focused on. Anything you want to add on global or global innovation from Lenovo's perspective?
The other thing we're starting to see is this adoption of other technologies, other clinical delivery systems, and willingness to explore them in different environments. Whether it's China doing genomics and what they're doing over there, which is amazing, and then actually blending that with facial recognition, so you walk in and not only do we know who you are, but we have your genome when you check in, and all of those pieces. But we're also seeing a tolerance for and an adaptation of the different clinical delivery methods in different environments, and you leveraging research and the communication protocols to say, hey, how are they doing that over there?
Right.
This doesn't work over here, but hey, that's working over there. And more exposure to an awareness of that, whether that's an AI research bot that says, oh, you were looking for this, they're doing it over here, and it's populating information, or it's as simple as engaging the right people. It's been pretty powerful.
It's excellent. Farhad, anything? Do you guys do work outside of the U.S. right now, or?
No, we're primarily 100% inside the U.S. We have a whole deployment in Eastern Europe, actually, that we started with. We're working with the Ministry of Health in a country out there, but majority of the work's in the U.S.
Excellent. What institutions are you focused on? Who's a good customer for you, and where do you focus your efforts today?
I mean, we're working with Kaiser Permanente right now, and we're doing a deployment in Los Angeles. And then we're also working with a lot of what's called accountable care organizations, clinically integrated networks throughout the East Coast. And we figured out a way to, remote patient monitoring is a big new push by Medicare. It started January 2019.
Yeah.
And we've helping them, not only reimburse it, it's free to the patient. The providers can generate revenue, and it's also, going inside homes and improving outcomes.
Excellent. Where are you guys located? Where's your headquarters?
We're in Northern Virginia.
Cool. Excellent. Awesome. Well, gentlemen, it's a fantastic panel. We covered a lot of ground. We started locally and went global, but I appreciate your time, guys, and thank you very much. Excellent. And for everyone listening, thank you for joining us today, and please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HITadvisor, and you use the hashtag ThisJustIn so you can respond to your comments from the show. In addition, all my content's always posted on my website at justinbarnes.com. Thanks, everyone. Have a terrific week.